Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here. Hey, everybody. Welcome back to the Fiat Health Podcast. My name is Caroline. I'm a family nurse practitioner, and today I'm joined with Amanda. How are you, Amanda?
I'm doing well, Caroline. How are you?
Good. For anybody who doesn't know, Amanda is a family nurse practitioner as well, specializes in women's health and fertility. I mean, master of all trades, but that's what she loves to do. And today we wanted to jump into a topic that I think we see a lot, and we thought would be fun to just bring some clarity to a lot of recommendations that people get out there. So it's really common for us to have people who come into the clinic on like a legitimate laundry list of supplements. And I know from my own personal experience of social media and living in the world, it's like so overwhelming. You're like, oh my gosh, do I need that? Like, you've convinced me in your Instagram reel that I should be on this supplement or that supplement, or like those are my exact symptoms. So we just wanted to talk through a couple different groups of women specifically, and kind of what is recommended, what isn't recommended, maybe what you want to seek guidance on before getting on and like testing certain levels. Obviously, in like the most ideal situation, we go to a provider and we get all of our blood work done. But I also know for some people that's not realistic or maybe attainable financially. And so kind of dealing with, instead of that ideal personalized approach, what can we do, on our own without seeing anybody maybe to help with these different particular groups. So anyways, I'm babbling on. Anything you want to add, Amanda?
No, I completely see the same thing where people come in on laundry lists of supplements, and it's hard with social media to decide what to be on. And so I think this is a great topic to go forward with.
Yeah, absolutely. Okay. So we're going to start with adolescents, adolescent females. What would you say every adolescent should be on this, or they should be on nothing? Just kind of what are your thoughts?
So with adolescents, I think that one of the biggest and probably most overlooked things is that nutrition should be stressed. I think my generation definitely, but even the current generation, there seems to be this mentality of when you're a teenager, you can eat whatever you want. Mm-hmm. And the truth is, no, you are going to be laying down the foundation for what your fertility health and other things are going to be built on for the rest of your life.
Yeah.
And especially now with more and more insulin resistant teenagers, that is absolutely not the case. So stressing high nutrient dense foods. I don't know how many times I've gotten calls from parents and they're like, can you just give me a supplement because I don't want to do these diets with my kids? And the answer is no, I can't give you a supplement. You need to do a good diet. But most people in the United States are deficient in vitamin D. So I think vitamin D is a very important one for adolescents. And because the adolescent female body does require so many nutrients that maybe even our food supply doesn't provide us with, doing a high quality multivitamin that contains methylated B vitamins and methylfolate is good. But apart from those two things, vitamin D and a multivitamin, I would try to get as many nutrients from foods unless you're dealing with a actual health problem that you're trying to fix.
Yeah, absolutely. And I know we recommend a lot, like the primary care side, like the Seeking Health multivitamin. It also comes in a chewable form for any of your adolescents who can't handle pills. Tastes fine. And yeah, I mean, I've seen so many tanked vitamin D levels in adolescents because they just, especially if you got a video gamer or someone who's like not super social and just like they're in a classroom literally like 8 or 9 hours a day. And they're coming home and doing homework. Like they don't see the light of day.
Right.
And so really that vitamin D, totally important. And then, yeah, the diet. I mean, It's so hard. I mean, we just got through doing so many school physicals for the month of July and August, and all the adolescents coming in for their yearly physical. And I'm like, I get it. Like, they have a will of their own. Some of them are driving, and there's only so much you can control as a parent. But like, even from a young age, fostering that culture in the home of healthy eating. I've had some incredible teenagers, and I'm sure you've seen some, who are like so aware and so well educated on their diet. And not to say that they're perfect, but like they've definitely taken ownership over that. And I just love when that happens.
Absolutely. It's a beautiful thing.
Okay. So next age group after adolescence is childbearing age. So this is, basically whenever you get your period till it's a very big span, but just an overarching, not with any issues, not trying to get pregnant necessarily or anything like that, just childbearing age. Any recommendations that you would give for that?
Similar to adolescence, good diet, but adding in a prenatal vitamin. I'm a big fan of the prenatal vitamin, sometimes even for adolescents, but definitely from age 18 through menopause, because there is, especially when there's a potential for pregnancy, and you really should be on a prenatal vitamin at least 4 months before conceiving. It's just a good idea to have it there as a foundation.
It's already there,
if a pregnancy would occur.
What's the major difference, would you say, between like a general multivitamin and a prenatal that's like makes it worth it?
The nutrients are generally, the amounts are higher. Now, not all your prenatal vitamins are created equally, which pretty much means if you're going to Walgreens or a grocery store to get your prenatal, that's probably not the right place, because many people cannot absorb folic acid, and most of those prenatals have folic acid in them. And so your higher quality methylated folate prenatals are going to be what you want to do. Some of the major chains are catching up and selling some products that are methylated now, but it's kind of hit or miss.
Sure. And we can definitely link some of the vitamins and supplements that we're talking about and the ones that we commonly recommend here in the clinic for anybody who's interested. Okay. What else is childbearing? Anything besides vitamin D, diet, prenatal vitamin?
Not particularly, unless you have a health problem going on.
Yep.
Really, those are the things I try to stick with, like as few as possible, unless we are actually treating something.
Yeah. And I think that's good for like sustainability for one, as well as financially, buying a whole bucket full of vitamins is not cheap. And so I totally agree. Always trying to keep it as minimal as possible. Okay. So on to our first issue, let's say. PCOS. So anyone who's been diagnosed with PCOS, let's say, they're coming to see you maybe in 3 months. What would you be like, oh, I'd love to see you like right out of the gate on these particular things?
So most of the time with PCOS, they have a propensity towards vitamin D deficiency. So definitely high dose vitamin D. I typically do recommend a bit higher, like more like 5,000 international units a day for people with PCOS. And then doing inositol, which is a supplement that can help lower insulin resistance. And it's an over-the-counter powder. You can add it to your food. It's low risk. Those are two things that I always put people with PCOS on. There's some good information about the anti-inflammatory effects of N-acetylcysteine with PCOS. So that's one that we commonly do as well. But every other supplement for PCOS, besides, of course, a good prenatal vitamin, is really individual specific and what kind of issues they're typically dealing with, how severe the insulin resistance is. And those are all things we'd have to detect via lab work.
What are some common ones that you use, say, once you do that detection or do like the lab work? What are some other things that may end up being added on with that added knowledge?
So sometimes we end up adding more vitamin supplements besides just vitamin D. Deficiencies are often present. If the inositol is not enough for insulin resistance, sometimes I'll add berberine, especially for someone who really doesn't want to go the prescription drug route. Those are the most common.
Most common. Awesome. And then endometriosis.
Endometriosis is a little bit hard because it typically is a surgical issue. And so no matter what we do to try to fix pain and inflammation, depending on how severe it is, often surgery is required. N-acetylcysteine has a pretty good track record with endometriosis. So that's one that I do usually automatically start people on. It's low risk. It helps your immune system. So that one really does work. There's some good information now on ginger supplements for a natural pain relief. So sometimes we'll do that. And then, of course, your vitamin D and prenatal, as we talked about before. But otherwise, a lot of what we have to do with endometriosis is prescription because of how severe pain can be.
Right. And like with PCOS, I mean, obviously PCOS is very nuanced and like a whole rabbit hole. But in general, you're talking about, there is some insulin resistance. And so those supplements are, going towards the root cause, so to speak, of treating that insulin resistance. Where, like you're saying with endometriosis, like none of these supplements are going to take away endometriosis. They're not going to solve it. What we're trying to do is make it manageable so that you're not in pain and, laid up in bed for 2 days when you're on your period. But really, surgery is the
it's
ultimate.
Like the gold standard. Yeah. Depending on how bad it is.
Sure. Okay. A big one that I feel like is probably the most marketed of all is fertility, right?
Right.
You're trying to get pregnant. You're trying to get, infertility, whatever, optimizing fertility. So please help us out.
So the big one, as it's sort of like a foundation, of course, is your prenatal. You're going to hear that over and over again. It's definitely worth saying. And vitamin D. Apart from that, there are different supplements that target different populations. So if you're worried about egg health, whether that is because your AMH is low or because you're over 35, CoQ10 is very important. N-acetylcysteine comes into play as well. And then fish oil, especially EPA fish oil, because it's more anti-inflammatory. So those are big ones for egg health. There's definitely some good information out there about other things for egg health, like melatonin even. But because melatonin is itself a hormone, I usually recommend you see a provider before you start that, specifically for egg health. There is a great book, if anybody's interested, called It Starts with the Egg. And they go through a lot of different fertility supplements. And I think that if you're really serious about fertility, getting that book and reading through it to understand what supplements are safe and not is important. Alpha lipoic acid is one that gets named a lot. And while it is really helpful for some women, it is not good for women who have thyroid problems. And many women have thyroid problems and don't know it. So that's one I would not start without some lab work. Otherwise, it's really condition specific what you're treating fertility wise. If a woman has an MTHFR mutation, of course, high dose B12 and folate. Depending on how severe the mutation is, very high dose B12 and folate, but that's all going to be lab work too.
That totally makes sense. What are some common ones you see people come on? I guess besides the, was it ALA?
ALA, yeah.
That maybe people commonly come in on.
So I will often see people on quercetin or turmeric or resveratrol. And there's conflicting information about how helpful those are for fertility. Some of them even may be detrimental. So it's better to consult a provider before you start any of those, especially, but just in general, supplements that maybe aren't tested or don't have a great track record.
And we were talking before we started recording too about how a lot of times when you come in with all these supplements you're taking, it's really hard to decipher what's actually helping, versus what's not helping. And so do you sometimes, I'm sure you'll pull people off. Do you ever just go on a supplement hiatus? I'll do that every once in a while with patients that come on with so much and they've been on for a long time.
Definitely. I think for fertility, especially, sometimes just starting back at square one and kind of building up, especially if you've been taking a lot of stuff that maybe doesn't have great research behind it or is experimental, is a great idea.
Yeah, absolutely. Okay, let's see here. Okay, next is thyroid.
Okay.
You love thyroid.
I love thyroid. Thyroid's my favorite. So thyroid, it is a good idea to be on a high quality prenatal, like I said, for any woman. But there is a specific prenatal that tends to target thyroid vitamins specifically, and that's the optimal prenatal from Seeking Health. Because thyroid requires vitamin A, iodine, selenium, zinc, and other nutrients for optimal function. And so if you want the right amount of those nutrients in a prenatal where you don't have to think about adding an extra thyroid supplement, that's the one to go with. Now, with thyroid, you do have to be careful because iodine is this slippery slope where you can take the right amount of iodine or you can take a lot of iodine.
Yeah.
And more is not better. In fact, more can send you the other way, can send you into hypothyroidism, which I've actually had happen in practice where there are different schools of thought on this, but I had a patient who was taking high dose iodine 25 or more times the recommended value daily.
Oh my.
And ended up with actually hypothyroid numbers. So iodine is not something where more is always better. You really do want to target this acceptable range. And then selenium for thyroid is kind of a fun one because Brazil nuts have so much selenium in them that you can eat 2 Brazil nuts a day and it equals the amount of selenium you need for thyroid for the entire day. So if you want to save money on a supplement, buy a bag of Brazil nuts. But fun story, you can also overdose on selenium. So I had a patient who was addicted to Brazil nuts, no joke, and I didn't know it. And so I checked her selenium levels and they were 2,000 times the recommended daily value. It was obscene. Gosh. And I was like, what is going on? And she was like, well, I do eat like a bag of Brazil nuts every day.
Oh my gosh.
And it really does play out on your labs. Like it was insane. And so we stopped the bag of Brazil nuts every day and it came back to normal range.
Was she on Brazil nuts? She was like, I heard it's good for me and I'll take it. Or she's just like, I love Brazilian.
She just loved Brazil nuts. And I had never met anyone who loved Brazil nuts that much, but it does play out on the labs. So
I remember 5-10 years ago when iodine kind of like came to be of like this thing, it was like a thing for a minute of like, oh my gosh, we're all iodine deficient, thyroid stuff. And then it's like, oh, everybody just take iodine. And so interesting though. Yeah, you can take too much and then that's going to affect your thyroid. And that's so funny about the Brazil nuts. I made the mistake once of like buying a bag from Costco before really trying Brazil nuts. And I was like, I don't really like Brazil nuts.
It's funny because they're really not that great. Like I'll eat 2 a day, but maybe not more. So,
oh, that's great. Okay. Preconception. So obviously just I'm thinking about I'm getting married soon. I want to get pregnant in the next 6 months. Is there anything outside of vitamin D and prenatal that I should be doing?
So diet definitely plays a part. My favorite diet ever is the Mediterranean gluten-free diet with minimal carbs.
Yeah.
And that really can carry you a long way for fertility and it can carry you a long way for a lot of other health issues.
Absolutely.
So that as a supplement would be one thing I would recommend. If there's advanced maternal age involved, the CoQ10, the NAC, and the fish oil for egg health are a good idea. And I think with preconception, if you are 35 or older, just get some basic labs. Even if you don't know if you have a fertility issue or anything like that, some basic labs, because a lot of women are low on DHEA in this time period, and that's a great supplement to take. But you never want to take it without a lab level because if you're high on it, you can actually cause yourself problems.
Oh, man.
So that's one reason to have preconception labs. Other things, really no. That's where I would start with those things.
Yeah, and I know that like the Mediterranean diet, low carb, that's like what we recommend for weight loss, for instance. It's just like a great place to start in general if you're like, I want to reset and like work on my health for women. There's so much data behind the Mediterranean diet. And it's just great for inflammation in general. And then can you define advanced maternal age for us in case anyone's listening and is like, is that me?
So advanced maternal age would be anyone who is 35 or older trying to conceive.
Okay. Is it common to go to a primary care provider and they're going to draw DHEA preconception?
No.
Okay. I didn't think so.
Probably would need to see a specialist for that.
Yeah.
And even so, probably someone who is well-versed in fertility because DHEA is not a common lab that's drawn.
Yeah, that's what I figured. Anything else for advanced maternal age? I think you said it. You said, repeat it again for me.
Oh, the NAC and CoQ10 and fish oil are probably safe bets for egg health. Otherwise, good idea to get some labs because there's a lot of other things you can add, but you really don't want to do that without lab levels.
What's an example of like a patient you recently had maybe with advanced maternal age who came in and like what labs you ended up putting her on once you got the blood work back?
Supplements. So sometimes we'll do actual thyroid support supplements, like if the thyroid comes back abnormal, especially for a woman who's maybe borderline and doesn't want to be on prescription medications. There's different good ones out there on the market from like orthomolecular or pure encapsulations, but you don't want to start those unless you know you have a thyroid problem.
Yeah.
Those are common ones. Iron supplements, a lot of times these women are low on iron, and iron can help your thyroid. So sometimes we'll do that. Those are big ones. But yeah, other than that, I think that's about what we typically do.
Yeah. And then what about in pregnancy? I think you get pregnant and then it's like, I don't want to take anything besides my prenatal, and vitamin D. Is there anything outside of that you'd find other than like someone who has some issue going on, obviously, that'd be beneficial?
So you'd want to check the prenatal to make sure it has an adequate amount of choline, because choline is really important in pregnancy. And some of the prenatals do not have much. And so a choline supplement is something to consider. But other than that, if you don't have any health problems, we're not treating anything, prenatal and vitamin D, and just let it go.
Okay. How much choline should be in there? I know I'm putting you on the spot.
Gosh, you are putting me on the spot.
We can add it to the notes.
We may have to add it to the notes. I think it's 400, but I would have to go check.
Yep. Yeah, I get it. Okay. How about perimenopause menopause? Anything to support? That's really like dealing with symptoms.
Yeah,
right?
like hot flashes, things like that. There are several supplements that we have trialed, like herbal supplements, like evening primrose oil or tribulus, which is a libido supplement.
Oh.
Varying results, whether or not it's really helpful. They're not likely unsafe, just maybe not super helpful. Most of the time, good nutrition is something we really emphasize, and then checking lab levels, because the labs usually tell you what's happening. The occasional person will benefit from something like chasteberry extract, which is Vitex, but that is more helpful to do in the context of like knowing there's an existing low estrogen,
right,
or knowing there's an existing high prolactin level, something like that.
Yeah. And I feel like that a lot of people I know are talking about HRT too for that. Kind of what's your take on, I know this is kind of off topic in some sense, but on like is every perimenopausal menopausal woman doomed for HRT to get through her symptoms?
Not necessarily, but HRT is an amazing gift that unfortunately has been overlooked because of some not very well put together research from the early 2000s.
Okay.
So I'm a big fan of HRT, especially from bone health and UTI prevention, things like that. You do have to be careful with it because, do we really want everybody on it? But especially for vaginal symptoms, I think that I was recently listening to a urologist who was talking about the financial drain on Medicare for UTIs and how they create these ICU visits and deaths and everything, and that these could be prevented if we just put every woman on vaginal estrogen, which doesn't even have really systemic side effects.
Interesting. So, and for anyone, HRT is hormone replacement therapy. Sorry. Which is typically topical.
Oh, it just depends. You got patches, pills, topical. You got all sorts of fun stuff.
All the things.
All the things.
Okay. Last one really is breastfeeding.
So breastfeeding is a high demand time. And so the prenatal needs to continue. A lot of women are like, oh, the baby's been born. We're done. Prenatal. It's not a prenatal. We don't need prenatals. No, you do. Your body is giving out way more. In fact, the calorie expenditure is higher in breastfeeding than it is in pregnancy.
Sure.
So that is important in vitamin D. It's a good idea if a woman is suffering from low milk supply to get some labs, because sometimes helping insulin resistance or thyroid can actually improve that milk supply. And then there's definitely supplements that can be taken in breastfeeding. Herbal supplements are hugely effective depending on the condition. Now, you'd want to see a lactation consultant to identify what condition's actually going on. Is it high supply, where with oversupply, you can take certain herbs to bring it down. And then, of course, with low supply, you can take certain herbs to build it up.
Okay.
Every woman should be aware of starting anything that has fenugreek in it because fenugreek does not work for many women who are insulin resistant or have PCOS or thyroid disease, which unfortunately is a huge percentage of the population. And it's in a lot of things.
And I feel like that's the one I most commonly hear people say.
Oh, yeah. It used to be like the one everybody was handing out. And then we started realizing, this actually doesn't work for
everyone. For those who don't know, Amanda's also an IBCLC, and we will do a breastfeeding podcast and touch on all the things. Maybe we'll have you and Ashlyn do it. But yes, that's a whole nother topic. But for breastfeeding in general, have you looked into like the prenatal versus postnatal much?
I don't have a strong opinion on it. Sometimes switching vitamins is stressful, but I don't have a problem with postnatal. It generally does have, a good amount of nutrients in it. So if a woman wants to switch, sure. But if it's easier to just like hit, rebuy on Amazon and, get the same thing, you're fine.
I feel like it's just marketing, in my opinion. Like, I don't feel like there's enough of a substantial difference to be like, oh yeah, you need a postnatal instead of a prenatal.
Right. That's kind of how I feel about it too. But you do have to be careful with some things that are marketed as hormone boosters or helpful, like Vitex, for instance. I have a fun story with this one. Vitex is often used for PMS symptoms and boosting hormones with cycling. And I had a cycling breastfeeding patient who started it and her supply went away.
Oh my gosh.
Just gone. And we realized, Vitex actually inhibits prolactin. Who knew?
Oh, goodness.
Kind of need prolactin for breastfeeding, so we're not going to do that again.
Lesson learned. Yeah, I had a patient who came in on some herbal something, and she's like, oh my gosh, like my supply dried up, whatever. We're like thinking about all these things. I was like, did you start anything? And she's like, oh yeah, I did start this, and it was marketed, towards just hormone, like in general, hormone health.
Yeah.
So you're like, oh, well, my hormones need help. I just had a baby.
Right.
And she started it and it was like, oh, actually, that's like significantly affecting your milk supply. So we're going to stop that.
Yes.
So similar to, I feel like and I have a lot of patients who are really cognizant of this. They text me with every little supplement they add for breastfeeding, which in general, I feel like a lot of times they're totally fine.
Most of the time.
Yeah. But it is like that kind of similar mentality of like, you do really want to be like when you're pregnant, not taking anything extra. Similar with breastfeeding, you really don't want to add in like these extra supplements and things if you don't have to and you don't need them. Okay. Any final thoughts? Anything we missed?
I was going to say, as an aside, I can't remember if we covered this with adolescents, but if an adolescent is depressed, it's a good idea to check vitamin levels. And that's true for anybody of any age.
Right.
But it is amazing to me 100% of the time, if I have a depressed or anxious patient and we check the vitamin levels, they're functionally suboptimal.
And what would be some that you look at real quick?
Yeah.
And the optimal range for it? Like, what are the main ones? Because I can tell you what I look for, but I want to hear what you say.
Absolutely. Vitamin D, really 50 or higher, 70 or higher, ideally, but I don't exceed 100. I stay within the range.
Yep.
Vitamin B12, 700 or higher. Folate, ideally 20 or higher. Those are my mainstays. Those are my big ones. You can also check B6 and iron, but the B12, folate, and vitamin D, every time one of them is out of range with a depressed patient.
For sure. That's what I look for. And yeah, iron deficiency. I had a recent adolescent who was, their iron, they were so deficient. And they were extremely anemic and their vitamin D level was like 10. I don't know, something
so
crazy.
Sad, yeah.
And I'm like, no wonder you're sad. Like, we got him in counseling too. But it was like, let's also, get your vitamin levels up. Maybe you'll feel a little bit better. And he did. He turned around and it was really great. So, okay. Well, I hope that's helpful to everybody. Bring some clarity around this whole like marketing scheme of various social media platforms. And feel free to reach out to us with any questions. We'll link everything we talked about in the show notes. And thanks for the chat, Amanda. It's always a pleasure.
Thanks, Caroline.
Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.